Hello, my name is Dr. Adrienne Hicks, and I am the founder and professor of the USMLE Master System. Today I'd like to begin our video series on sexually transmitted diseases. The first thing that you should ask your patient if you think that they may have a STD is to see if they have either a painful or painless sore, or if they're experiencing any discharge. Let's begin by talking about sores. If your patient presents with a painless sore or a painless canker, you should think that the patient might have syphilis. If your patient presents with painful sores, you should decide if the patient has herpes simplex or if the patient might have Haemophilus ducrei. Let's begin on talking about syphilis. Syphilis is caused by a bug called Treponema pallidum. It is a bug that will affect the partner during sex and will cause a painless sore, just one, or a painless canker. Now, the canker can be treated with penicillin, but if the patient decides not to be treated right away, or if it goes away before they are treated, it will go away, but it will present in 6 weeks in a different form. It can present in 6 weeks as arthritis, really bad arthritis in which people may or may not know that it stems from the syphilis, or it can present as a rash, such as condyloma lata. So, again, the best treatment is penicillin. And if it's not treated then, it can go back into your system and come back in about 6 years as either a cardiovascular problem or neurological problem. It will affect your aorta by causing a tree bark appearance. It's going to be very thick, and blood flow is going to be hard to come out of the aorta. And it can affect your nervous system by affecting your gait. It will affect your dorsal column. It can also affect your vision by causing a condition called Argyll-Robertson pupil, in which your eyes are able to accommodate but will not react to light. You will get gumas. So the rash will come back in different forms with primary, secondary, as well as tertiary syphilis. All these are different forms of syphilis that can all be treated with penicillin. But if you're still suspecting that your patient might have syphilis and they're not currently with the presentation of it, you can test for it. The best treatment can either be dark field microscopy or VDRL. You can also test for FTA antibodies. These are less specific, as well as testing other antibodies such as ANA or anticardiolipin antibody, which are also positive in other conditions such as lupus. So if you suspect that your patient has something, it's best to get blood work as well as look at whatever presenting symptoms that they have, so you might diagnose it clinically. But the best treatment is penicillin. So keep those questions coming and turn back in to see the rest of our video series on sexually transmitted diseases.